Is there such a thing as food addiction? From my perspective, yes. Hello, and welcome to the Dr. Suzette Glasner Podcast. Don't forget to hit like and subscribe to my channel if you want to continue to learn from me. And if you have any comments, questions, or suggestions for a topic or guest that you'd like me to invite to the show, please feel free to drop them into the comments or email them to me at askdrglasner@gmail.com. I would love to hear from you. Today, I'm going to talk about a question that I am often asked as an addiction scientist and expert. Is there such a thing as food addiction? And from my perspective, yes. But what I'm going to focus on in our conversation today is 3 lines of evidence that there is such a thing as food addiction, so that you can have a little bit of a better understanding of the parallels that food addiction shares with addiction to drugs and alcohol. Here are 3 things to help you understand food addiction. So the first one is central to any addiction is a loss of control over the use of something. So when we think about alcohol and drug addiction, really the sort of hallmark sign that we look for when we're diagnosing someone with what we call a substance use disorder, the most severe form of which is thought of as an addiction, is whether control over their use of alcohol or another substance is slipping away from them. And there are lots of signs and symptoms of that we will go through in a diagnostic interview to try and understand that better. So when it comes to food and food addiction, the same hallmark sign is really the defining feature of addictive behavior around food, which is when a person loses control over their intake of usually certain types of foods. So some people may continuously attempt and express a desire to reduce their use of a substance in the same way that people with addictive behaviors around food or food addiction will express a desire to reduce their food intake, to lose weight, to control themselves, but they repeatedly fail to do so, even though there are emotional and social or even health consequences of their food intake, in the same way that we see psychological, social, and health-related consequences of excessive alcohol or substance use. Now, this turns out to be especially true with ultra-processed foods. So examples of ultra-processed foods that the FDA recommends avoiding due to the health risks associated with them are flavored potato chips, soda, candy, instant ramen, and packaged baked sweets like cookies or cakes that are prepackaged. And ultra-processed foods, as well as foods with a high glycemic load, can lead to this addictive process that is very much akin to what we see with drug and alcohol use disorders. So, in other words, these ultra-processed foods can really promote this sort of escalation of intake, some withdrawal symptoms when the foods aren't available or present, pronounced cravings, and even relapse despite attempts to discontinue intake of these types of foods. So, colloquially, this kind of syndrome has come to be known as food addiction, even though we don't have a formal diagnostic label of food addiction in our diagnostic system for mental health disorders, at least not yet. There are certain types of compulsive eating disorders, where binge eating disorder, for example, that describe a certain way of consuming foods excessively, but it's not the same as food addiction. Does it exist, however? Absolutely. From my clinical and research experience, I would say there is really good evidence that the same type of addictive behaviors we see around alcohol and drugs take place in certain vulnerable individuals with food. One question you might have is like, why is there this especially high likelihood of a person developing addictive behaviors around ultra-processed foods versus other types of foods? So the reason, as we understand it, that we need to do a lot more research on this, is that most ultra-processed foods are designed to be highly rewarding. And that's through combinations of very tasty and palatable types of ingredients and additives that enhance their flavor and texture. So it's sort of this hyper-rewarding nature of ultra-processed foods that make them capable of sort of triggering addictive mechanisms that increase the likelihood that a person is going to get into a sort of compulsive pattern of intake. So losing losing control over their intake of these foods, experiencing these intense kind of cravings, and continuing to eat them even though there are some negative consequences. So there have been some studies on this recently, and they show that about 14% of adults would meet criteria for what we would call ultra-processed food addiction. And the way that we assess that is using a measure of sort of compulsive behaviors around food, again, that mirror what we see with addiction to alcohol and drugs. So eating more of them than a person maybe planned to or meant to, making rules for themselves about eating a certain amount or only eating them on certain days and then finding that they're breaking them, or noticing that they're starting to have some health issues or weight gain or some undesirable impact of eating these ultra-processed foods, but feeling like they can't stop themselves from eating them anyway. So those are, again, all the same types of signs and symptoms that we see when a person is losing control over their drug or alcohol use, but now we're seeing it in the context of eating. There's also recent research that shows that ultra-processed food addiction is associated with poor physical health, mental health, and social well-being. So it's a real thing and a problem that needs to be addressed that I think people often under-recognize. And here's the reason why food addiction type behavior patterns are under-recognized. So my point number 2 is, like addiction to drugs and alcohol, addictive behavior patterns around food can look different for different people. So the classic pattern that people associate with food addiction is constant overeating. Overeats at every meal, overeats every day, all the time. But if you think about alcoholism, I have seen many patients for whom their pattern of drinking, even though they meet criteria for problematic alcohol use or what we would call an alcohol use disorder, they don't drink every day. Just like some people with food addiction don't overeat every single day. Some people with an alcohol use disorder just binge out on the weekends, but then they go to work every day during the week and they just don't break that rule that they don't drink during the week. But when they binge out, they drink really large quantities and they take on a lot of health and safety risks. They have negative consequences for their alcohol use that they continue to drink despite. So it's the same thing with food addiction. You have people who overeat every single day as a general pattern. Those are the individuals that'd be easy to sort of point out because you see the way they eat consistently and go, wow, that person has a food addiction. But then there are other people with addictive behavior patterns around food who will just engage in discrete binge eating episodes, but they're binging hard. Like they are eating large quantities of food. They're making themselves sick with the quantities of food that they're eating, and the types of foods that they're eating are also going to have health consequences for their body weight and body image. And it also is associated with this sentiment and experience of loss of control. That's just another pattern by which food addictive behavior can manifest itself. And then there's a third type, and this is what's referred to as compulsive grazing. So this is different from what we would call non-compulsive grazing. So non-compulsive grazing can actually be a dieting strategy, and it could be an effective one where you're eating very small quantities, maybe a little bit more frequently throughout the day, but you're doing that very intentionally in order to lose weight. So you're sort of like nibbling throughout the day in sort of controlled portions. That's very different from compulsive grazing. So compulsive grazing involves this loss of control and this repetitive inability to resist consuming relatively small amounts of food over an extended period of time. And that's whether you're hungry or you're not hungry. You're just dealing with cravings and temptations to eat little amounts of foods that could be ultra processed, they could be sweets, they could be salty snacks, they could be sodas, they could be candy, but you're compulsively eating these little amounts all throughout the day. And this is a known barrier to people reaching their weight loss goals, maintaining a healthy weight. This is a known barrier to success of treatments for obesity. So it's a real driver of weight gain and unhealthy body weight and unhealthy BMI. And because it may be in these small quantities and it just feels like lots of snacking, it might not be something that people intuitively associate with addiction or addictive behavior, but it actually is a subtype of addictive behavior. So again, food addictive behavior can present itself in different ways in different people. It's not all the same. And we see the same thing with drug and alcohol use disorders. You have people who binge periodically, you have people who use or drink every single day. It's really not the same for all people with addiction. And even though we're holding them to the same kind of diagnostic system, diagnostic criteria for determining if they have an addiction, they can look very different from one another in terms of their behavior patterns. Another thing that scientists are starting to understand around compulsive overeating or other food addiction addictive behaviors is that addictive behavior patterns fall on sort of a continuum. So they can actually progress from some of these milder, unhealthy eating behaviors, frequent snacking or occasional overeating, and then binge eating. And that can actually progress over months or years into addictive behavior patterns where a person feels like they really can't control their eating behavior. And this is similar. You can think of it sort of in the way that early problems with drinking may start, right? You may have somebody who's college age who's binge drinking periodically, and that could progress into a full-blown addiction over time in the same way that unhealthy eating behaviors can progress into a food addictive behavior pattern over time. The third reason that I believe that there is such a thing as food addiction, and I've seen it in my clinical practice, is because the treatments that work well for drug and alcohol addiction also seem to be effective for addictive behavior patterns around food. So I'll just give you two examples. One is a therapy technique called cognitive behavioral therapy. Cognitive behavioral therapy is an evidence-based, a science-based go-to treatment approach for drug and alcohol use disorders. It involves understanding unhealthy thought patterns related to substance use, the reasons that a person uses substances. So the thought patterns may be, I need it to function, I need it to cope with stress. The same type of therapy is effective for food addictive behaviors. So you're catching the thought patterns that you have around food, like, I'll just have one cupcake, right? And then you're checking, is that really rational? When was the last time I just had one cupcake? Every time I eat something really sugary like this, I end up eating 6 of them and losing control. So I have to abstain from it, that kind of thing. So you're sort of checking for how rational your thoughts are, and then you're working on changing your thoughts and your behaviors around eating. This is the same technique as we use for drug and alcohol addiction that has been found to be effective for helping people with food addictive behaviors, binge eating disorder, and other kind of compulsive eating behavior patterns. The other treatment that is sort of an exciting innovation that is in early stages for alcohol and substance use is GLP-1s. We are starting to see evidence that GLP-1s like Ozempic are helpful to curb cravings and desire for excessive alcohol use. And so it's sort of an emergent potential treatment for alcohol use disorders. And we know that it's effective for eating behavior and reducing overweight and obesity in individuals who are struggling to control their intake of food. So given that these same psychotherapy and medication treatments are effective for both forms of addictive behavior, we're on to the fact that there is some overlap in the biochemical processes that regulate eating versus alcohol and drug intake behavior, and that's something that we can capitalize on as treatment scientists to develop effective ways of helping people who can't control their use of food. So the reason that I'm bringing up this topic of food addiction at this particular time is because we are entering the holiday season, and this is a time when people with or without food addiction often struggle to control their consumption of ultra-processed foods and other unhealthy foods. And so in my next episode, I am going to give you some tips and tricks that are tried and true and scientifically based to help you navigate the holidays without gaining weight, without slipping backwards if you're already on a path to changing your eating behavior, and also a few tips and tricks for starting to recognize if you or someone you care about may have some addictive behaviors around food that they need to address, because we do have effective ways of helping people to change these behaviors. But the first step is to recognize that this is a problem, as with anything. So I hope you learned something valuable, and I look forward to talking with you about managing your eating during the holidays when I see you next time.